How do non-PCOS women, when it comes to oxidative stress, compare to women with polycystic ovarian syndrome in terms of just baseline oxidative stress levels? You just described it's kind of like rusting. So just talk to me a little bit about kind of that as a foundational core pathophysiologic mechanism.
Yeah, so, in theory, we suspect that individuals with PCOS have higher oxidative stress levels than those without PCOS. In reality, when we test the labs, like I usually test oxidized LDL, also take a look at things like uric acid as well. We don't always see those levels be elevated. Even on a more comprehensive nutrient panel like a NutrEval, where we're taking a look at several oxidative stress markers, may not see them be abnormal, which could be due to several factors. We have lots of PCOS patients with PCOS that take really good care of what they're eating, manage any type of toxin exposure as well. So it may just be that they're able to mitigate some of that stressors. The mechanism of action is really because your body is trying to develop multiple follicles at once, even though it isn't intending to do so. And because we're kind of condensing what we would normally spread out through multiple menstrual cycles into your one menstrual cycle, which is how we can get this irregularity in periods, it essentially is, again, an even more energy dense process, and I would say an energy inefficient process. And so inadvertently can contribute to more oxidative stress because your body's trying to do more than it normally would in that menstrual cycle. The other pieces to PCOS that I think are really important is really this idea of hirsutism. So this kind of activation or increase in testosterone levels. We're also usually more likely dealing with hyperinsulinemia or insulin resistance, which again, it can be a result of elevated oxidative stress, elevated inflammation as well.